patients. I have noticed that most people become very scared when they hear the word cholesterol. When people get a cholesterol test and show me their reports, many of them look very worried. They often think that high cholesterol means they will definitely have a heart attack. The question is, does cholesterol really cause heart attacks? Why are people in our society and around the world so afraid of cholesterol? Why do we spend thousands of rupees on medicines, face their side effects, and keep trying to lower cholesterol? To understand this, we need to look back at history and see how this idea began. Let me take you back to the years between 1959 and 1969. An American physiologist worked as a physiology professor at the University of Minnesota. The American government asked him to study why so many people were having heart attacks and other heart diseases. An American physiologist traveled to different countries and studied people in about 7 nations. His research became known as the 7 Countries Study because it included 7 countries. From what he observed, he concluded that cholesterol was connected to heart attacks. He believed that people were having heart attacks because they ate too much cholesterol and saturated fat, including butter and similar foods. This idea became known as the cholesterol hypothesis. According to this hypothesis, cholesterol was seen as a major cause of heart disease. He started his work in 1958. Around the same time, American President Dwight Eisenhower also developed heart-related problems. After this event, more attention was given to research on the causes of heart attacks. Research in this field grew quickly, and many experts eventually decided that heart attacks happened because people ate too much fat. Both saturated and unurate fats were increasingly blamed for heart disease. By 1987, people around the world had been convinced that high cholesterol caused heart disease, and that cholesterol increased because people ate too much fat and cholesterol. In 1987, the first commonly used cholesterol-lowering medicine, lovastatin, was introduced. You can imagine how much money this medicine earned. For almost 20 years, people had been made extremely afraid of heart attacks. Lovastatin sold in such huge amounts that several medicines introduced after it could not earn the same amount of money, even when their sales were combined. By that time, however, people had also started questioning the original findings. Even though people reduced fat, butter, and ghee in their diets, heart attacks did not disappear. In fact, the number of heart attacks appeared to rise. The theory had already become deeply accepted. People were no longer willing to question it because cholesterol-lowering medicines reduced their cholesterol levels within a few weeks. They then believed that lower cholesterol meant they would live longer and would not suffer a heart attack. We will discuss later how true this belief really is. From 1987 until today, many doctors, especially cardiologists, have repeatedly advised patients to avoid ghee and butter. These guidelines were supported by well-known doctors, medical groups, health organizations, and leading medical experts. The same idea was also added to medical education and the courses used to train medical students. Over time, this belief became so strong that even today, many people find it very difficult to think differently. Now the question is, what do good cholesterol and bad cholesterol really mean? We can understand many things by simply using logic. Ask yourself this question: how can the same substance made inside one body be both good and bad?
We are often told that LDL cholesterol is bad and HDL cholesterol is good. However, LDL and HDL are not cholesterol themselves. LDL means low-density lipoprotein. It acts as a carrier.
You can imagine it as a taxi. LDL carries cholesterol from the liver to other areas of the body. Cholesterol is placed inside this carrier in the liver and taken to the tissues that need it. After the cholesterol is delivered, the carrier becomes mostly empty. Therefore, LDL itself is not cholesterol. It is a transport vehicle that carries cholesterol and fats from the liver to the rest of the body. HDL means high-density lipoprotein. It is often called good cholesterol because it picks up cholesterol from different parts of the body and returns it to the liver. The liver is the body's main processing center. It processes cholesterol and either uses it or removes it based on the body's needs. Therefore, HDL and LDL are not two separate kinds of cholesterol. They are lipoprotein carriers that move cholesterol away from the liver or bring it back. When cholesterol leaves the liver inside LDL particles and moves to other parts of the body, is this helpful or harmful? It is usually a necessary and useful process because many tissues in the body need cholesterol. Before we continue, there is one more important point. The body delivers this glucose to its organs and tissues based on their energy needs. The remaining glucose is then sent to the liver. The liver stores a limited amount as glycogen. However, when there is more glucose than the body can use or store right away, the liver converts the extra glucose into fat. Before we continue, there is one more important point. When you look at your lab report and see your cholesterol level, do you think all of that cholesterol came directly from the food you ate? Most of the cholesterol in your body does not come directly from ghee, butter, or other foods that contain cholesterol. About 85% of your body's cholesterol is made inside the body, while only about 15% comes from the food you eat. Your body can make around 3,000 milligrams of cholesterol every day. God has placed the body's main cholesterol factory in the liver because cholesterol is essential for many important functions. If the liver stopped making cholesterol completely, it would be very difficult for the human body to survive. Eventually, the liver becomes filled with too much fat and needs to send some of it to other parts of the body. It packages this fat into lipoproteins, especially LDL and other particles that are rich in triglycerides, and releases them into the bloodstream to carry them to other tissues. These particles can carry both cholesterol and triglycerides. When people look at their lipid test results, they often notice that their triglyceride levels are high. They become worried, see a doctor, and are quickly given medicine. The important thing to understand is that if you are worried about cholesterol and triglycerides, you should also be concerned about the foods and metabolic conditions. The next question is whether cholesterol is made simply because a person eats ghee or butter. The answer is no. So, what should you be concerned about if you are worried about cholesterol? Think about the large amounts of carbohydrates many people eat, including pizza, burgers, pasta, bread, soft drinks, energy drinks, desserts, and other processed foods. Starchy foods are also carbohydrates. These include potato chips, potatoes, sweet potatoes, rice, and foods made with refined flour. When we eat these foods, the carbohydrates are broken down into glucose,
Starchy foods
also
dissolve
called
in the
sugar,
stomach, breaking down into
inside the body
carbohydrate
and
molecules.
converts the extra glucose into fat.